Good evening, everyone. Myself, Arshdeep Singh, Assistant Professor, Meera Medical Institute of Nursing and Hospital, Abohar. Today, I am going to explain you about the topic, and I am continuing with the topic that is minor ailments, and today it will be part 2. So, some of the minor ailments I had explained in my previous lecture. So, today I am going to continue with that topic. So, let's start the topic. So, in the previous lecture, I had completed up to the fever, acute fever. Next one is the sore throat. So next one is the sore throat. So as it would be the sore throat, there must be the swelling. There will be the swelling in the throat. So the symptoms would be pain on swelling. Second one, how would we manage this sore throat? It would be like second, inspect throat for redness and white patches. If these are present, that may indicate the signs of diphtheria. So if there is the presence of the white patches and there is a redness in the we can say that the throat, so it may be diphtheria. Okay, then immediately refer that person to the hospital. Next is take throat swab if necessary and facilities exist and send the sample to the lab. So we have to do the culture if there are the presence of the white patches or any other type of the situation that would look abnormal. Okay, so we have to take a swab throat and send it to the lab for the culture. Second, next one is if there is a whitish gray coating and difficulty in breathing in children, these are the signs of diphtheria. So if there is sore throat, it might be leading to the that we can say that there might be the presence of the diphtheria if we are having sore throat problem for such a long duration. So we have to immediately refer to the hospital or to the doctor, consult with the doctor or hospital. Next, check the vital signs. Next is advise saline gargles. So we have to put some salt in the water and do the gargles with that water, like 1 teaspoon of salt in a glass of warm water. Next, if fever is present, give antipyretics. So it is obvious antipyretics are for the fever. Next, advise bed rest and adequate fluids, and advise syrup of honey with lemon juice and hot water. It would repel any type of irritation in the sore throat, and that would reveal a relief. It will provide relief to the throat. Okay? So, and last is in case of recurrent tonsillitis, refer to the hospital. If the condition is severe or any type of tonsillitis condition is present, then immediately refer the patient to the hospital. So that is how we will manage the sore throat. Next is the heat stroke. Heat stroke. So what is stroke? When there is excessive lightning, I would say lightning. So you can say that the sunlight or excessive heat or humidity. So body can a stroke can affect the body in the physical manners. I would say it is characterized by high fever, headache, and rapid pulse. These are the symptoms of the heat stroke. Okay. Next, person suffering from heat stroke should be kept in a shade and well ventilated place. So as I have already said that uh, persons who would be suffering from the stroke because it may be due to the excessive sunlight during the summer. Okay, so they might be kept in the shade and well ventilated place, and note the temperature after they are having stroke. The condition of stroke. Note the temperature, pulse, respiration, and blood pressure. Expose the abdomen and extremities of the person, wrap him in a wet sheet because the body already having suffering from the heat stroke. So body is heated up. So we have to wrap him or her in a wet sheet so that we can provide some of the cooling effect. Do not cover the chest. So chest should not be covered. Next, keep him wrapped in the wet sheet till the temperature falls to 38 degrees centigrade. Okay, so we have to lower down the temperature of the body up to the 38 degrees centigrade. So we have to keep the patient in the wet sheet. Next, if the patient is conscious, give him cold water mixed with salt and other cold drinks. In condition, if the patient is conscious, then we have to give some of the things that will decrease the temperature of the body, like some of the cold water and other type of liquors, that is salt and other cold drinks. Okay, salt mixed with other cold drinks. Next is record the temperature, because the body is heated up, and record temperature, pulse and respiration every 15 minutes, so as to check the present condition or the scenario of the patient. Next, till temperature comes back to the normal. Till the condition of the patient or the temperature of the patient, the person gets normal, we have to check the vital sign every 15 minutes. And last one is, as soon as there is some improvement in the condition of the patient, refer him to the hospital. Okay, so while I would say that if there is any improvement in the condition, so immediately refer him for the further services or the care. So that was about the heat stroke and how would we manage it. Next is the cough. That was, first of all, is the simple cough, in which there is we can say that the patient, the condition of the patient is, we can categorize the patient in the general condition. Okay, no any type of moderate or severe condition is present, so we can manage it in a very calm manner. Like dry cough may be present along with slight sore throat, advise saline gargle. That is the best way to treat the simple cough, with plenty of the fluids, and give cough mixtures as per agency policy. Any type of cough syrup, expectorant, I would say that. So that has to be provided to the patient. Next, if the cough is present with the fever, cough with the fever, then in many conditions or in many infections or diseases, the patient may suffer from the cough and also with the fever. So how would we manage that? So it includes difficulty in breathing. First of all, what is the sign? The various sign. So cough with fever can be associated with the pneumonia. That is, what are the main signs? That is, difficulty in breathing and rapid breathing may be present. Nose movement along with breathing, and blue color of the nostrils or the nails and fingertips. These are the some of the signs that may be present. If child is suffering from this type of condition, then immediately refer him or her to the hospital and give the cough mixture as per the agency policy. That would help to relieve the cough. Give antipyretics so as to decrease the temperature of the body or to treat the fever, and advise bed rest, light diet, and plenty of the fluids. That are the same as for the simple cough. And last, if no improvement in 3 days, condition may be associated with any type of moderate or severe condition, so immediately refer the patient to the hospital. Okay, and last one is cough. That would be prolonged cough. Prolonged. So the prolonged cough include if cough for more than 2 weeks and is accompanied with fever and sputum. So these can be the signs of tuberculosis. Like we were studying about the sore throat. So when there are the presence of the white patches in the throat, that may be associated with diphtheria. Likewise, when we are talking about cough and it is a prolonged cough, for example, for more than 2 to 3 weeks, and is associated with fever and sputum, that can be related with the presence of the tuberculosis. That means a person can be suffering from the tuberculosis. Okay, so what are the signs and how would we manage it? Ask for the weight loss. Is there any type of weight loss? These are the signs of the tuberculosis. Loss of appetite, chest pain, and blood in sputum. That is hemoptysis, and that is the main. We can say that the confirmatory. We can say that the sign and symptom for the tuberculosis. These are the suggestives of tuberculosis. And how would we manage and diagnose if the tuberculosis is present? Then collect 2 specimens of sputum on the spot and second sputum next early morning as per the instruction in the DOT scheme. Under the DOT scheme, we have to take the two sputum samples for culturing in the lab. Okay, one should be done at the on the spot, and second one on the next day. Okay, next, advise rest and high protein diet. So that is beneficial in case of the person having long cough or in case of tuberculosis. And last, refer to the health center for further investigation and treatment with DOTS therapy. And DOTS is the assured treatment in case of the tuberculosis. So if this is present, So that might have to be followed in a very careful manner. Next is the conjunctivitis. So what is conjunctivitis is? It is the inflammation of the conjunctiva. It is the white portion of the eye due to germs, irritants, or the allergens. It is practiced by people who use saffron dipped cloth to wipe eyes for soothing purposes. Okay, so when there is the inflammation of the conjunctiva due to germs, irritants, or allergens, that condition is known as conjunctivitis. Okay, so what are the how would we manage the conjunctivitis? Is firstly, irrigate eyes with saline or clean boiled water if available at home. Boil the water, let it cool down, and then clean the eyes with that water. Next, clean eyes with cotton or soft clean cloth if available at the home. So the cloth that we are using to clean the eye must be must not be dirty to any extent. Okay, it should be very clean and apply drops or ointments according to the orders or as prescribed by the doctor. Next, demonstrate cleaning and application of the eye drops or ointment. So, how ointment or the eye drops had to be poured in the eye. So, it should be demonstrated by the nurse to the patient. And next, refer to the hospital if needed, if the condition is moderate or severe. So, refer it to the uh, hospital immediately, and such as if pain due to foreign body or any injury exists. Last one, refer in case of sharp decline in eyesight if any infection does not respond even after 5 to 6 days of treatment. So, when we are continuing with the treatment, but the condition is not improving, so immediately we can say that consult with the doctor. It might be any type of the major condition. Okay. Next is the diarrhea, and it is one of the major uh, causes in case of children that may lead to the death of a number of or lakhs of children in India are just due to the diarrhea. Okay, so collect data regarding onset, duration, frequency, and associated symptoms. So assess the person for the presence of the diarrhea, its frequency, duration, from how much time it is affecting the patient. Next, monitor the symptoms of the dehydration. If the dehydration is severe or the patient is in a state of shock, immediately refer him to the hospital. So, if there's the condition of the shock, we should not try anything at home. So, immediately refer him to the hospital because there might be the fluid and electrolyte imbalance. So, that have to be maintained by the use of any type of drip, that may be NS, or any other type, depending on the condition. Next, packets of the oral rehydration mixture, that is ORS, are freely available at all PSCs and CSCs, hospitals, and chemist shops. So, that is a very effective treatment. I would advise the you, like the students or any other type or any other person who is listening or watching my video, that now is the time of the summer. So we should carry 1 or 2 packets of the ORS wherever we are going, like for the long distance drives or at the long destinations. Okay, because the temperature in this summer is up to the extent, so we can say that excessive heat is present in our environment, so it might affect our body, and we can have the diarrhea, the condition of the diarrhea. So to manage that condition, we should be using the ORS. Okay, so that would be very beneficial for our body. Okay, so ORS, as recommended by WHO, is available in every medical store, so we should consume it if we feel that our body is having fluid and electrolyte imbalance or the conditions of the diarrhea. Okay. Next, rice water, coconut water, lemon juice, light tea, banana, khichdi, etc. should be given to the patient. So these are the food products that might help to relieve the diarrhea. And if no improvement in 24 hours, refer to the doctor. And if there is epidemic of vomiting and diarrhea, refer to the hospital or PSC. Next, if cholera is prevalent, then people should be immunized against it. So diarrhea, the condition of diarrhea may be associated with the cholera. Okay, so that might also be one of the conditions that we can associate it with diarrhea. So that might be a condition. So patients or the persons must be, or the people of the community must be vaccinated by the vaccine of the cholera. Next is people should be educated about controlling the flies, cleanliness of the water to drink boiled water, food hygiene, and for the proper disposal of etc. So it might be due to any type of vector that is flies. So we must keep proper sanitation so that we cannot suffer from any type of the condition of the diarrhea. And last, give medicines as per the need. So medicines should be given to the person. Next is the severe diarrhea. So if 6 or more loose watery stools in 24 hours, that would be the condition of the severe diarrhea. No fever, vomiting, or blood would be present. Watch for the symptoms of dehydration, that is shock and weight loss. Okay, so each and everything is written here in an explained manner. So I have to explain a very little. Sunken eyes, rapid and steady pulse, these are the symptoms of the severe diarrhea. So these are the symptoms of the shock or diarrhea, severe diarrhea or condition of the shock. So if this condition is present, immediately refer to the PSC and treat with the oral rehydration solution because it is the assured treatment for this condition. If child is on breast milk, advised to continue the same and advise environmental hygiene that would include the fly control, that means the vectors, either type of mosquito or the flies. Food hygiene should be there and water hygiene should be there to prevent the cases of diarrhea. Teach proper disposal of excreta and if non-improvement in 24 hours, refer to the hospital. Next is diarrhea with blood and sputum. So that may be the we can say that very severe condition. Symptoms include stools with blood or mucus, gripping abdominal pain. So pain would be present in very we can say that in a very high frequency. Children should be referred to the doctor at once. And next is adult. Give ORS and otherwise stool test. And last is referred to the doctor for treatment. Okay. So in case of severe condition or diarrhea with which includes the blood and mucus, for that condition, we have to consult with the doctor immediately. Next is the toothache, that is the pain of the teeth. So it might be due to various conditions like the food items stuck in our teeth and the non-maintenance of the oral hygiene, or there are various conditions. Okay, advise mouthwash with potassium permanganate 3 times a day. That will help to relieve the tooth pain. Give aspirin to relieve the pain, and if fever is present. And advise dental care and checkups to rule out the caries. So dental caries would be present in the tooth, so that might be also the reason for the pain. Next, advise to eat amla, orange, lemon, guava, tomatoes for healthy gums. So these are the food items that would help your gums to grow in a healthy manner, or that would keep your gums in a healthy manner, and it would also relieve the tooth pain. Last is refer to the health center or hospital if no relief, or if no relief is there by using the potassium permanganate oral wash or any other condition, immediately refer to the patient to the hospital. Next is earache, that is the pain in the ear and ear discharge. That means some type of mucus or wax is oozing out from the ear. So, what are the symptoms? Pain may be present and discharge may be watery or purulent. Next, carefully clean the ears from outside only. Do not try to clean the middle ear. If we are going to clean the middle ear, we may puncture our eardrum, so we can have the deafness condition. So very carefully we have to clean our ear in a very careful manner. Only the outer ear must be cleaned. Avoid any probing by using a pin or hair. These should not be used while you are cleaning your hair. Okay, and look for any discharge or purulence, furnicle, etc. And if any discharge with external ear soreness present, clean it with hydrogen peroxide. That is a very good thing. Hydrogen peroxide. It will ooze out any other type of foreign particle or any type of wax that is uh, causing the pain in the ear, or any type of discharge is present. Give tablets for the pain and still ear drops that might be helping to relieve the earache. Last, refer if no relief in 2 days or if associated with other problems like fever, nose, and throat infection. Okay. Next, foreign bodies in the nose, ear, eye. So, what are the things? Nose, ear, eyes. So there is a presence of because these are the portal of exit or entry in our body. So some of the things uh, would be acting as a foreign body if they get stuck in our nose or ear or eye. So never pour water. How would we manage this? Never pour water. If these are seeds, they will grow and swell, and it would be difficult to get them out. Okay, so that will be obstructing the function of the hearing, or it might be obstructing in the nose. Next, advise patient not to rub the eye if the foreign particle is in the eye, and refer to the health center or hospital immediately. Okay. Next is the constipation. That is the condition. These are some of the condition that we usually come, or that usually suffer us when we are at home, or any we can say that the hospital, or when we are on our job. So these are the minor ailments. Next is the constipation when stool is not passed daily, and after 2 to 3 days, or stool is passed with some pain. Okay, so it is constipation. Advise plenty of fluids. That is the best method. Fruit and more leafy vegetables and food with natural fibers. The food with the fibers is very good food or the alternative method to relieve the constipation. Advise the elderly to walk and exercise to encourage volume movement, and give mild laxative that will uh, help the waste of the stool to pass easily. Okay. Otherwise, discourage use of laxative or purgatives. Okay. So these might be used in very limited amount. Okay. Firstly, the diet should be managed according to that situation. That there should not be any type of situation like constipation. And if stool is not passed for 2 to 3 days, pain or vomiting or distension are present, then immediately refer to the doctor. Next is painting. Fainting is the condition of the like some unconsciousness. It may be due to shock or diarrhea or dehydration. Lie down the person, make the person lie down. His head should be slightly at a lower level than the feet, because to increase the blood supply to the brain. If the person is sitting, keep his head bent between both the legs, reason being the same. Give first aid, and if bleeding or fracture is present, we have to provide the first aid. Person should get fresh air. So fresh air is very because we have to maintain the airway. So the fresh air is a basic need. There should not be any crowd around him. Keep him warm and reassure the family. And once the person gains his consciousness, ask him to take deep breaths and give him hot liquid spray. Or when the patient is, we can say that the conscious, then we have to provide these things to drink. Okay? And if the unconsciousness continues, send him to the PSC hospital for the further treatment. Okay, so that was about fainting. That is a condition of unconsciousness. Next is the convulsions. Last one for today's topic is convulsions. So convulsions, we can say that the seizures, some as a type of seizures. So it may be due to many causes or the factors. First of all, let the person lie down safely on a bed or floor, or if bed is not available, with head turned to one side. Okay, so we have to prevent the rolling of the tongue backwards, because it might obstruct the breathing, and it would obstruct the airway, so that may lead to the death of the patient in some conditions. So we have to maintain this position. Loosen his clothes from chest and let the fresh air come. Okay. Next, place a bandage roll or a spoon covered with a clean cloth between the two to prevent tongue bite. So mostly in case of the convulsions, the person might be having the tongue bite. So that method, that to open the mouth with a spoon, or there should be the something, or we can say that we have to place a bandage or a spoon covered with the bandage. Okay, so that we can prevent the tongue bite. Next, do not restrain your feet, because it may lead to the fracture. We don't have to restrain the person with any type of rope or any other thing. Clean the secretions from mouth, because reason being the same. to prevent the respiratory tract obstruction. Next, protect from fire and sharp stones and try to ascertain the possible cause of convulsions by taking history. What is the reason why these convulsions are affecting the person? So, is the person epileptic, or is the person a drug addict? Because in many conditions, these can be associated with the withdrawal symptoms. Okay. Next, give him hot tea with plenty of sugar when covered from fit, and if nothing works to relieve the person from the convulsions, or repeated convulsions are there, so immediately uh, consult with the doctor for the further treatment. Okay, so that was about the convulsions, and that was all about the today's topic. So that was about the minor ailments part 2. That was about today's topic. So friends, we will meet in the next week with the next topic. Okay, so that would be minor ailments part 3, and I would explain you about each and every minor ailment and the role of the community health nurse in the minor ailment. Okay, so that was all for the today's topic. Thank you everyone. Thank you very much.